Good afternoon, folks. This afternoon's topic A is as follows. America is about to have a lot more senior citizen. What that means for everything from health to housing signals a major demographic shift. And the article it explores the profound ripple effects this will have across society. Here's a breakdown of the key insights from the surrounding page content. Okay. First headline, guys. The aging boom. What's happening? Baby boomers turning 65. Over 10,000 baby boomers reach age 65 every day. By 2050, the number of Americans aged 85 and older is projected to nearly triple to 18.6 million. Not all seniors are the same. The article emphasizes that lumping everyone over 65 into one category obscures the real issue. Those over 85 are far more likely to need intensive care and supports. Health implications. Elder care crisis looming. Seniors over 85 are eight times more likely to require nursing home care than those aged 65 to 74. Chronic illness on the rise. Many seniors are living longer but spending more years in poor health, with increased rates of cognitive and physical disabilities. Caregiver burden. As the need for elder care grows, so does the pressure on family caregivers and healthcare system. Housing challenges. Affordable senior housing initiatives like Boston's Two Life communities aim to provide housing that includes aging services, combats loneliness, and reduces care costs. Scalability is key. These models work well locally but need expansion to meet national demand. Policy responses. State level innovation. Give me 1 second, guys. California removed asset limits for Medicaid eligibility. Washington created a universal long-term care insurance program funded by payroll taxes. New York released a master plan for aging. Federal uncertainty. The Trump administration eliminated the Administration for Community Living, raising concerns about future elder care planning at the national level. The big picture. The article warns that without proactive planning, the U.S. will face a massive elder care shortfall. The oldest baby boomers will begin turning 85 in just a few years, triggering a surge in demand for care, housing, and support services that could overwhelm the current systems. If you're curious, I can help you explore how your state is preparing or not for this shift. Or we could dive into what this means for future careers, investments, or even your own family planning. The surge in America's senior population, especially those over 85, is poised to dramatically reshape healthcare services in the coming decades. Here's how. Increased demand for long-term care. Nursing homes needs will skyrocket. Seniors over 85 require nursing home care at 8 times the rate of those aged 65 to 74. As millions of baby boomers cross that threshold, facilities will face overwhelming demand. Home health services under pressure. More seniors will need help with daily activities, driving up demand for home health aides, occupational therapists, and geriatric specialists. Rise in chronic and cognitive conditions. More years in poor health while people are living longer. They're spending more time with chronic illnesses like arthritis. Diabetes and dementia. Americans now average 12.4 years of life impacted by chronic conditions, nearly 30% higher than the global average. Mental health challenges, loneliness, depression, and cognitive decline will become more prevalent, requiring expanded mental health services tailored to older adults. Workforce shortages, caregiver crisis. The healthcare workforce isn't growing fast enough to meet the needs of aging patients. Family caregivers are already stretched thin, and professional caregivers are in short supply. Specialized training needed. More clinicians will need geriatric training to manage complex age related conditions effectively. Financial strain on systems. Medicare, Medicaid stress. These programs will face mounting costs as more seniors require expensive long term and acute care. State level innovation. Some states are responding with creative solutions like Washington's universal long term care insurance and California's ex- expanded Medicaid elig- eligibility. But scaling these efforts nationally remains a challenge. Like Boston's two life communities offer affordable housing with built in aging services, reducing healthcare costs and improving quality of life. But these models need broader adoption to make a national impact. In short, healthcare services will need to evolve rapidly, expand capacity, and embracing innovation and rethinking how care is delivered to meet the needs of a much older America. If you'd like, I can show you how your state is preparing for this shift or explore what careers might thrive in this aging focused healthcare landscape. The latest trends in healthcare technology for seniors are reshaping how age, aging adults receive care, making it more personalized, proactive, and accessible. Here's a roundup of the most exciting innovations. Aging in place with smart home tech, voice activated assistants, devices like Alexa, Google Home help seniors manage daily tasks, control lighting and temperature, and stay connected with family. Fall detection and emergency alerts. Smart sensors and wearables can detect falls or irregular movement and automatically alert caregivers. Remote monitoring systems. These track vital signs like heart rate, sleep patterns, and medication adherence, allowing healthcare providers to intervene early. AI powered health platforms. Vital Signs Intelligence, or VSI platforms like Alpha, Alpha Hind used motion sensors and AI to monitor seniors 24/7, analyzed changes in health patterns to prevent crisis, predictive analysis, analysis. These tools help forecast health risks and personalize care plans based on real-time data. Companion robots. Give me 1 second, folks. Emotional wellness support robots like Paro and Moexi offer companionship, reduce loneliness, and assist with cognitive therapy. Market boom. The healthcare companion robot market is expected to grow from 3.1 billion in 2025 to 16.3 billion by 2035. Hybrid care models, virtual and in-person clinics, OSF, complete care 55 plus. Chicago blends telehealth with on-site services, offering 24/7 access and care navigation for seniors. Care navigators. These professionals help seniors manage insurance, appointments, and wellness programs, streamlining the healthcare journey. Tech enhanced senior living communities. Hospitality meets healthcare. New housing designs integrate wellness, amenities, social spaces, and tech enabled care to support active aging. In an intergenerational uh, interaction, communities are being built to encourage engagement across age groups, which boosts mental health and vitality. These trends reflect a shift toward whole person care, while technology supports not just physical health, but emotional and social well being too. If you're curious, I can help you explore which of these innovations are available in your area or how to integrate them into your own care planning. Great question. These healthcare technologies for seniors aren't just futuristic concepts, they're already transforming lives in very tangible ways. Here's how they're being applied in real world settings. smart home integration for aging in place, fall detection systems, motion sensors, and wearable devices like Apple Watch or Lively alerts caregivers to emergencies to emergency services instantly when falls occur. Medication reminders, smart pill dispensers, e.g., MedMinder, notify seniors when it's time to take their meds and alert caregivers if doses are missed. Environmental controls, voice activated assistants allow seniors to adjust lighting, temperature, and appliances without needing to move around, reducing uh, risks and increasing comfort. AI predictive health monitoring, 24/7 health surveillance. Platforms like Vital Signs Intelligence use AI and motion sensors to monitor seniors' health patterns, flagging early signs of decline before crisis hits. Caregiver health tracking. Apps and wearables can monitor speech, movement, and behavior to detect early signs of dementia or depression. Robotic companions and social engagement. Paro, a therapeutic robot used in elder care facilities to reduce anxiety and improve mood among dementia patients through tactile interaction. Social, social robots, devices like LEQ encourage conversation, remind users of appointments, and even suggest activities to combat loneliness. Hybrid care models. Virtual clinics. Programs like OSF, Complete Care 55 Plus, offer seniors 24/7 access to care teams via telehealth, reducing unnecessary ER visits and improving chronic disease management. Care navigation platforms. These help seniors manage appointments, insurance, and wellness programs, streamlining the healthcare experience. Community based tech solutions. Two Life communities in Boston combine affordable housing with integrated aging services, allowing caregivers to serve multiple residents efficiently and combat isolation. Mobile health units equipped with diagnostic tools and telemedicine capabilities. These bring care directly to underserved senior populations. These applications are not just improving health outcomes, they're enhancing independence, dignity, and quality of life for millions of older adults. If you're curious about how to implement any of these in your own life or community, I'd be happy to help you explore options. Implementing healthcare technologies for seniors comes with a host of challenges: technical, financial, cultural, and logistical. While the innovations are promising, scaling them effectively is a complex endeavor. Here's a breakdown of the key hurdles. Okay, digital literacy and adoption. Tech Tech hesitancy. Many older adults are unfamiliar or uncomfortable with new technologies, making making adoption slower. Training needs. Seniors often require hands-on support to learn how to use devices like smart speakers, health apps, or wearables. Uh, accessibility design. Interfaces must be int- uh, uh, intrusive with large fonts, voice commands, and simplified navigation tailored to aging users. Cost and affordability. High upfront costs. Devices like Champion robots, smart home systems, and remote monitoring platforms can be expensive. Limited insurance coverage. Many of these technologies aren't covered by Medicare, Medicaid, leaving seniors to pay out of pocket. Income inequities. Lower income seniors may be excluded from tech enabled care, deepening the deepening health disparities. Fragmented healthcare systems. Lack of integration. New tech often doesn't uh, sync well with existing electronic health records or care workflows. Coordination gaps. Without centralized systems, data from wearables or home sensors may not reach doctors or caregivers in time. Policy and security concerns. Seniors and families may worry about data breaches or surveillance, especially with AI powered monitoring. Scalable and infrastructure. Scalability and infrastructure. Pilot programs versus national reach. Community based models like two life communities work well locally but are hard to uh, replicate at scale. rural access. Seniors in remote areas may lack broadband or cellular coverage needed for telehealth and smart devices. Workforce workforce shortage. Even with tech, human caregivers are still essential, and there aren't enough trained professionals to meet growing demand. Okay, guys, so that is A for you. I will be back on shortly with B. Give me a bit for B, please, and I will be back on with that for you. For now, Gator Wellness, take care, folks.